Good evening, everybody, and thank you so much for joining us for this important conversation on the future of interpreting. I'm Maria Ceballos Wallace, and I am the host of the podcast Subject to Interpretation, and I am thrilled to welcome colleagues from 6 leading organizations here tonight, each representing a vital sector of our profession. Some quick housekeeping matters, which we need to just, get through really quickly. This session is being recorded and the link will be emailed and posted on our YouTube channel. And because this is a webinar, attendees cannot unmute themselves. However, you can join the conversation by sending your comments and posting on the Q&A section so that we can then include your questions in our Q&A section during the last hour of the webinar, half hour rather. And we'll also try to monitor those comments from YouTube as well. So before we begin, I would like to thank the De la Mora Institute of Interpretation for supporting this forum. The future of interpretation depends both on skilled practitioners and on well-trained instructors. So if you're one of those, or you'd like to become one or the other, then you are in the right place. There's plenty of people here, plenty of associations that are going to give you the opportunity to pursue your dreams. So over the next 2 hours, we're going to explore challenges, opportunities, and emerging standards. Now, 153 of our colleagues, many who are present here today, participated in our pre-webinar survey. So we're going to be sharing those results with you today, and they will also be available after the webinar. A quick survey insight. 67% of you describe yourselves as cautiously optimistic or open to possibilities about the profession's future. So let's keep that positivity in mind. Now, as each organization presents today and responds to the questions we have prepared, they will have a certain amount of time to answer the question, and then we'll move on so that we can cover as many topics as possible. Then we will follow, like I said earlier, with the Q&A. So let's begin with our first question, which is looking ahead to specific sector challenges and preparation strategies, which we all need to keep in mind. Each of our panelists is going to have approximately 3 minutes and 30 seconds to share their views, the views of their organization, and we are going to see what the biggest challenges interpreters will face in their sectors over the next 5 years and how we can start preparing. So let's begin with Angie Birfield. Angie Birfield is she's a California court-certified Spanish interpreter and longtime labor advocate. She's president of the American Alliance of Professional Translators and Interpreters. Welcome, Angie, and share your wisdom with us.
Hello, and thank you for having me. It's a great pleasure to be here representing all of you, and I'm just thrilled to be here.
So tell us, Angie, what are the challenges that you see in the upcoming next 5 years for our profession, and how is APTI and your membership and yourself even preparing to start tackling them in advance?
Well, first of all, we are an advocacy organization, so we have created a representation of all sectors of interpretation, translation. I like to think of it as that we're all branches of the same tree, and therefore we should be working with each other, which is why I'm so thrilled about being here tonight with my colleagues that are also presenting. We believe that in the short term, the unfettered use of AI, for those who see interpreting and translation as just being merely a little check mark off the box, and that's referring to language service providers, some of them, not all. And that poses a challenge, and one of which we are acutely aware of, and we need to invest into establishing some sort of regulations into it so that we can keep that 67%, but bring it up to a 95 perhaps. The courts are seemingly signaling that AI may be integrated into language access. We're not sure yet. A lot of states have issued concerns because of their state budgets, which of course puts people in a panic and at times creates a lowering of cost of services rendered, if you will. Due to upcoming cuts such as Medicare and Medicaid, we have seen in California hospitals that have done what they usually do, and they have staff layoffs. Among those are the interpreters that were working for one particular hospital. And it's very interesting because the main language in this hospital is Cambodian, given the demographics of that area. But nonetheless, it involved the entire interpreting department. They have all been laid off, and the hospital has gone digital on demand. And this is per a published comment that was made by the Long Beach Watchdog, which quotes a spokesperson for the Long Beach Memorial Hospital, Miller's Children's and Women's Hospital as well. The education sector is also being negatively impacted by funding freezes and unscrupulous policies. While AI is a challenge, we feel that the biggest challenge is by gaining buy-in on legislative actions from elected officials. What we mean by buy-in is acceptance of and willingness to actively support, participate in a given subject. Buy-in, however, doesn't begin and end with elected officials. There seems to be an uphill battle to gain buy-in from interpreters and translators in the idea that legislative change can be achieved. This is why this is a challenge that needs to be met if we were to gain any buy-in from elected officials. Why? Because some may ask, it's because numbers are what elected officials respond to. Numbers equal political capital. And I also wanted to add that I just now found out that the courts in San Diego are outsourcing to agencies that are offering video remote interpretation to be paid by the minute. So these are the types of things that I think we need to really watch for. And one of the things that I'm going to repeat it throughout the evening is we need to be proactive rather than reactive, and we need to stop being complacent and really take action. Thank you.
Thank you so much, Angie. So, you've touched on a lot of different things: language access, buy-in from legislation, but also talked about how important it is for interpreters and translators to actually be their own advocates. Let's talk to Joanna Carrero Contreras. She's the co-author of The Community Interpreter and a 30-year industry leader. She chairs the American Association of Interpreters and Translators in Education, also known as AAITE. Welcome, Joanna.
Thank you, Maria, and thank you so much for the opportunity of this panel and to get us all together. To answer this question, I would like to reframe it a little bit and say that I would prefer to focus on what the next 3 years may look like rather than 5. And that's because, one, at the pace things are going, 5 years is simply too far out to project realistically. And also considering the potential challenges to the administration in 3 years, any projection we make today for 5 years could look completely different by then. Not to mention all the other factors like technology that are also changing rapidly. So, as for the challenges we see, we have 3 big ones that I see, and Angie has already alluded to some of them: policy disruption, AI, education. And what I would add to what Angie already said, without repeating the same thing, is that we have not seen anything like this before. And so we are really navigating uncharted waters. Confusion and disruption are becoming the norm unless we find ways to stand up to these challenges and respond strategically and competently. So the way we advocate, organize, and prepare ourselves as a profession will directly impact how language access survives and evolves in this climate. Second is the technology advancement at another layer of disruption. AI has created a tremendous hype, and with it, we have experienced a huge sense of fear. But whining about AI will not get us anywhere. It only fuels resistance and hostility. We have already experienced two major disruptions in the past: machine translation, remote interpreting. We survived those. But how? Not without raising our skills and adapting to new realities. And the same will be true for AI. This is the time to adopt and adapt. I personally think, and I think Angie alluded to the same thing, that policy disruptions are even bigger challenge than AI. But we need to have a strategy for both, and that's what brings me to talk about what I see the most fundamental challenge, which is our professional readiness. The need for stronger professional education is not new, but is now more urgent than ever. In our field, there are three main pathways that people take. All of three have limitations. One, we enter the profession by the seat of our pants. We are bilingual, multilingual, and here we go. Many of us join interpreting or in translation without any formal training or education. And while I'm glad the AAIT offers a space for them to grow professionally, like other associations here present, this highlights a reality that there's still no entry barriers, no real barriers to entry in our field. And if we cannot raise the standard of entry, how can we expect to compete with AI? Short courses is another opportunity to enter the field, and these courses can be excellent in many ways, but I have personally led countless programs for both interpreters and trainers, but on their own, they are no longer sufficient to create a well-rounded professional. And then we have the academic programs that have many more resources, yet they often fail to equip students with practical skills needed to thrive in a rapidly changing field. So how do we prepare? We must be, I agree with Angie, proactive and intentional. And we need to fight confusion and disruption with agility and stamina. So the three takeaways are: strengthen our education pathways, embrace technology strategically, and stay informed and organized. I can go on and on.
No, well, thank you very much. That's a great introduction for that. And it seems to me like by the time we finish here today, we might actually start creating a roadmap that we can start to propose and maybe refine together jointly. Let's move on. Thank you so much, Joanna. Our next guest is Christina Green. She is an ATA certified translator and a state court interpreter, and she is a director on the American Translators Association board, and she is head of its interpreters division. So welcome, Christina, and tell us what you have for us.
Thank you. Thank you very much. And thank you for welcoming us and for having us. ATA, as the largest association of language professionals. So we're very excited to be here. Can I just start? Perfect.
Absolutely. Please go
Okay,
ahead.
thank you.
The
Thank
clock
you.
is ticking.
Thank you so much. So you were talking about challenges. I was listening to my colleagues. Definitely the biggest challenge that we're going to have is the increasing integration and sophistication of AI and the machine learning technologies. That's going to be specific to automated speech translation and AI-assisted interpreting tools. So what we need to consider is the role of human interpreters in an AI-augmented world. So I think that's going to be the biggest challenge. So we all know what the downfall of AI is. I don't think we have to explain too much. You know, the inaccuracies, hallucinations. Very recently, we discovered that actually AI lies, even though AI is improving. So you will also have heard, probably, if you are a judicial interpreter, sorry, that Wisconsin is trying to push legislation to have all human interpreters in the courts replaced altogether 100% with AI. So of course, we're fighting this. There's a nice coalition formed by all the nice agency associations that you see here. So we're all fighting against this because we do know that this is going to have a ripple effects throughout the states if it comes to pass in Wisconsin. So we're trying to have them understand that the lack of human element and emotional intelligence is it's critical, because what we do is more than converting words. So it requires, I don't know, cultural nuances, nonverbal cues, emotional intelligence, empathy, blah, blah, blah. Now, there is another concern, and that is a big one, a privacy concern. We all know that the minute anything goes into the cloud, it's public and there's nothing else private. There's the ethical concern. We follow a code of ethics. How do we know that AI is qualified to follow code of ethics? Well, of course, it cannot discern what is okay and what is not okay. Then there is, of course, the bias in AI. And the bias, whether conscious or unconscious, right? Or the existing bias, whether it's unconscious or conscious, it can get perpetuated by AI and actually amplified. Okay, so that is going to be in disadvantage to, or particularly adverse to, the marginalized communities. Now, is there going to be some job displacement and skill shifts? Absolutely. But we cannot forget that there are technical limitations. People think that they are going to buy a machine or they're going to buy a phone, they're going to activate something, and it's going to work beautifully, and that's the only thing they have to do. The Department of Public Instructions just sent their budget study regarding this idea of replacing interpreters with AI for all the public offices in Wisconsin. And it was very interesting to see that the one thing they mentioned was that even though at the beginning they may have the appearance of costs that were lowered, the fact that you have to buy the software, train people on how to use it, integrate the software with the communication systems that an agency has, and then implementing, maintaining it, and updating it, it's going to be a very big expense. So this is not, just, oh, let's open the door. Okay, it's open. That's it. So this is going to provide, it's going to give a lot of problems. Not to mention what is going to happen when, I'm not going to say if, I'm going to say when the lawsuits start coming, when the mistrials start coming. There's nothing an attorney hates more than having a judge than having their case ruled as a mistrial or appealed, right? In the Court of Appeals. And hospitals are going to have the same effect when they have malpractice lawsuits. So what
Well,
I'm
let me
saying,
stop you right there for a moment,
yes,
so that we can bring in our colleague Natalia Mitareva,
okay,
since you've just mentioned
okay,
the medical sector and how this is going to be
yes,
affected. Now,
absolutely.
Natalia, she's the executive director and founding commissioner of the Certification Commission for Healthcare Interpreters. Welcome, Natalia. And I am just going to guess, maybe, I would even wager $1 that you're going to pick up on where Christina left off.
Yeah, thank you. Thank you very much, Maria, for giving me the floor. And I also thank everyone who is tuning in tonight. And let me offer you a slightly different take on the original question. I still want to think of 5 years, unlike Joanna, just because I want to think of 5 years and have some hope ahead of that, right? But at the same time, let me kind of interpret what the disruption in policies and disruption by AI adoption means for us, especially interpreters in healthcare. As you know, any system is as strong only as its weakest link. And in healthcare settings, unlike others, we have one very big weak link or weakness, and that is remote interpreting. I'm not saying anything new here, but the reason remote interpreting, especially for Spanish, is weaker in healthcare settings is because it is the largest sector that drives revenue for language companies. And unfortunately, I see the biggest challenge that within the next 5 years, we'll see a gradual loss of remote interpreting modality for Spanish patients because they will be replaced with AI solution. And by they, I mean Spanish remote interpreters, both by providers and patients, albeit for different reasons. Providers will see no difference in quality between AI solutions and remote Spanish interpreters. And patients may be afraid due to anti-immigrant sentiment to request interpreters, and they'll bring their phones. No matter how inaccurate they are, Christina, they will bring their phones because they will be too scared to say they don't speak English in this country, and they will use that AI phone app which hallucinates, lies, etc., to meet their immediate needs with the doctor, finding out how many pills to take, etc. So the potential lawsuits afterwards will not matter of what will happen immediately in the next 3 years, but I think we should start seeing the end of the tunnel in the next 5 about that. And the sad thing about this picture that I just painted is we made our own bed because most remote interpreting is done by bilingual individuals who work offshore. Many of them have not received any training in healthcare interpreting or do not know the healthcare interpreting realities or healthcare realities of the United States, like Joanna was alluding to. I know that there are certified interpreters who work remotely, of course. However, their pay rates are higher, and for that reason, their workload and coverage of calls are decreasing, right? And what we're left with in healthcare soon would be low quality of remote interpreting in Spanish will upset providers who can and do compare that with the staff interpreters they see, with the in-person interpreters we see, because there is a higher rate of certified interpreters among those populations compared to remote interpreters. And ultimately, they will replace remote interpreting with inpatient and in-person and staff interpreters because they will see no difference in quality. How can we prepare? I think we can turn this into an opportunity of starting to focus now on further improving the quality of in-person on-site interpreting, on increasing the number of certified interpreters. I know I'm tooting my own horn, but numbers matter and the strength is in them. And the more certified individuals we have who know the difference between what's accurate and what's not, the stronger we are as a profession. And I think each interpreter, each manager of language services, each interpreter training needs to be knowledgeable about AI solutions. And by that, I mean having nuanced understanding of how AI interpreting and translation works and how it improves constantly and immediately. By immediately, I mean that there are so many updates to AI systems right now that what they could not do a month ago, that AI now can do, right? So we cannot stop that progress, but all of us need to daily explain and still demonstrate that human interpreters, and by the word interpreters, I mean only certified individuals, human interpreters bring more value to direct consumers of interpreting and to organization they serve. There is definitely a benefit in being, qualified human being, especially in the healthcare settings.
Thank you so
Human
much, Natalia.
interpreters
I
are the ones
apologize
who
for
will
interrupting.
bring us back up into the, equal language access. Thank you.
Natalia, thank you so much. And I think this is, I appreciate your perspectives because we have Ana Soler. She's a PhD candidate, adjunct instructor of interpreting and translation at the University of Georgia, and the co-chair of the National Association of Educational Translators and Interpreters of Spoken Languages, one of the two organizations that represent educational interpreters here on this, on the panel today. It seems to me that there's being that educational interpreting is a relatively newer field, not that it hasn't that the services haven't been provided for a very, very long time, but it's professionalizing that maybe Anna has something to contribute regarding where they are, since they don't yet have certification exams, etc. Go ahead, Anna. Welcome.
Absolutely. Thank you so much. And thank you to the La Mora Institute for giving us this platform and actually for bringing us all together. We appreciate it, and everybody who's here today. So when I was thinking about this question, really the biggest challenge for interpreters in any field now or ever is to evolve with the field. So changes in technology and legislation, in policies and immigration patterns, and really in our own practices will always be present. But the interpreters that remain busy, the ones that remain committed to professional development, to mentoring others who are just coming into the field, for example, and who help organizations understand that, what quality access really looks like. They understand that changes are inevitable, right? The language access and equity and communication have always been areas that are not sexy to talk about, right? Where we really need to advocate whenever we can absolutely do it. So when we accept that changes will take place, we take precautions, we prepare, we engage with our communities, with other organizations that serve the people that we care about. And so really the biggest challenge that I see, and especially in the education sector, is for interpreters who collaborate with our schools as freelance and contract interpreters. Because school-based interpreters or bilingual personnel who have multiple hats can, collaborate with educators and many different families at the same time. And I acknowledge that wearing multiple hats can create dilemmas related to ethics, related to role boundaries, and all the essential skills that those professionals are usually not compensated for enough, right? However, school-based interpreters may not be as vulnerable as to these drastic changes in policies, precisely because of their dual roles. So they're not as easily replaceable, and their work to engage families, is still a federal obligation. And so to answer the second part of this question, we really should not be starting to prepare now. We should have been preparing for a long time and continue to prepare for all of the changes that will come, because this is not the first time that this will happen. But we also need to remain hopeful and understand that everything is a cycle, right? Everything will be changing. We need to continue evolving with the profession and continue engaging with each other. So thank you for asking this great question.
Thank you so much for your response, Anna. And last but not least, we are going to welcome Lily Selden. She is a PhD linguist and a veteran court interpreter, currently the chair of the National Association of Judiciary Interpreters and Translators, also known as Nagget. Welcome, Lily.
Thank you very much, Maria. It's a great pleasure to be here, and I welcome the audience and look forward to all of the ongoing discussion in the chat, and perhaps there will be a chance later for Q&A. Everybody has spoken so eloquently and powerfully about the many challenges that we're facing at the moment and some of the countermeasures, the evolution that we are going to have to undergo as members of the TNI profession. I agree wholeheartedly with everybody's sobering delineation of the challenges we face in terms of legislation, slashed budgets, disruption legislatively, and also in terms of the safety that our limited English proficient consumers may feel or not feel in requesting our services. And I want to talk a little bit about how Nagget, along with its peer organizations, its partner organizations, many of whom are represented here today, are looking ahead. One is we are trying as much as possible to streamline our processes for sending advocacy statements, for organizing our conferences, for everything that we can do to provide better ways to meet the needs of our members and our future members. We are trying to streamline our processes and work more effectively, more efficiently, collaborate more with other organizations so that we are sharing resources and in order to fight for better working conditions, to protect and protect interpreters' working conditions and educate our clients. And I myself, as an interpreter who speaks the language of lesser diffusion, Japanese, want to just throw out for people's consideration that diversification is something that I have always had to turn to ensure viability for myself. Whatever strengths we can bring to our interpreting, whatever additional background we can bring, if we can leverage that to expand our services, maybe away from language. Also, I'm going to encourage everybody to think about ways they can volunteer their time, even if it's 1 hour a month, 5 hours a year. Do something with your local organizations to protect your working conditions, to protect the profession. Thank you.
Thank you so very much, Lily. Really appreciate those thoughtful insights, as well as all of the others raised by our other panelists. I think it's pretty clear that interpreting is vast and it's multifaceted, and that in 2 hours we can't even begin to cover every issue or topic, including topics such as future certification, new legislation, and in this case, one that is relatively new, or at the very least, that has just really kind of taken over many of our lives, which is AI, and explore them in as much depth as we would like to. So I'd like to take an opportunity to share with you. I think I saw a couple of mentions in the chat regarding an organization called Safe AI Task Force. And I wanted to share with all of those people who are listening today that in Subject to Interpretation, we have had the pleasure of doing a 2-part series in which we have interviewed at 4 different members of the organization who represent 4 different aspects of interpreting: education, advocacy, sign language, and other kinds of interpreting. And they have really spent some time with me going through the basics, the ABCs of artificial intelligence, what we should know, what we need to know, and what we need to watch out for. So I'd like to encourage you that if you're interested in knowing more about, the background of it, not just the, ChatGPT buzz, then about ethical guidance, risk mitigation, and the practical tools, that you'll consider listening to those episodes, which are available on YouTube. They're available on the different podcast platforms. Now, regarding AI, our survey shows that ChatGPT and DeepL are interpreter staples. But many people worried about devices replacing us in court, in medical fields, and conferences and educational settings. Respondents called AI a game changer that cuts prep time from hours to minutes but we also have to take in consideration some of the downsides, which include the protection of data and personal information. Now, 34% of the participants in tonight's audience have anywhere between 10 and 20 years of expertise, with the median being 9.4 years, which means many of you bring seasoned perspectives and have watched this industry, the legislation, and the tools that we use evolve considerably throughout your careers. So then let's move on to another sticky topic, which has been mentioned a little bit in the initial challenges that our guests have spoken about. So let's talk about the federal efforts to promote English as the official language, in as much as rescinding the Executive Order 13166, restricting interpreter-related funding, and activities such as dismantling support structures like the Office for English Learners. What risks do each of the panelists foresee for language access in your sector, and how is your organization preparing to respond, advocate, or adapt? Now, it's possible that you may have already started this conversation with us when you answered your first question. So this is an opportunity to go deeper. And if you have other things to add, well, obviously this is the opportunity to do so. We're going to start in reverse alphabetical order, and we're going to ask Lily Selden from Nagget to share her thoughts with us.
I'm so sorry. Ana Soler is behind me alphabetically, so I was a little bit caught off guard. But let's see. So risks associated with language access. So there are, of course, as I think it was Joanna who mentioned, or no, it was Natalia who mentioned, patients and other LEPs afraid to request interpreter services. There are, of course, the budget cuts that are coming through both federally and regionally. There are also the increasing threat from legislative bodies wanting to save costs and without realizing the inherent risks of using AI before it's ready to be rolled out for use in situations like courthouses and hospitals. So from all over, and I would also add that increasingly, because of social media, because of the after effects of COVID and how that has affected children's ability to take school seriously, to be focused throughout the day, et cetera, that there are so many challenges placed on the linguistic proficiency that we are going to be able to expect from interpreters in future. So there are all of these challenges placed on us, all of these pressures placed on the profession. At the same time, however, I do think that because education is universally being watered down in the US at least, that there are going to be lower and lower standards within the courthouse as well, that we may not have to deliver the same range of high and low registers, that we will not be held to the same high standards, and therefore that will lead to an increasing lack of respect for interpreters unless we are able to shore up and continually elevate our profile as members of the TNI profession. So there's going to need to be continued emphasis on linguistic proficiency. We will continue to need to hold interpreters to high standards and not accept the courts wanting to hire interpreters who have only achieved 50 or 55% or 60% on exams. So one thing that Nagget is doing to combat that, last year we had a certification exam committee looking into the feasibility of a written translation exam to be administered by Nagget. The committee is still, it's at the moment it is dormant, but the new board is trying to revivify that committee and look into the feasibility of designing and offering an exam that would be for legal translators to have a credential that interpreters and translators could take to demonstrate their advanced linguistic proficiency in the field of law. So this would not be an exam to compete with the ATA exam. It would be a complement to that. But this is one way that Nagget can reclaim our voice as the experts on what legal interpreters should know and be able to do.
Thank you. Thanks so much, Lily. We look forward to hearing more about that as that becomes, it gets more grounded and reactivated. Let's talk now with Ana Soler from NETISL.
Sure, Maria. So really from the moment that NETISL was formed, we have engaged with educators, with multilingual families, with interpreters, with translators. And in fact, we work very closely with departments of education and school districts in various states to really continue advocating for quality interpretation and translation, and for that equity of communication that we want to reach. And this is done through professional development for school leaders, for bilingual and multilingual school personnel, but also quality training for interpreters and translators in education, and also through creating tools for multilingual families to self-advocate and really lift their own voices when it comes to quality of language access. And so we're strengthening these efforts with all of our stakeholders by advocating for language access, especially during times like these when the value of multilingualism is being attacked, when assimilation is being promoted, when, of course, as we talked about, artificial intelligence is recommended as the tool to address communication gaps. So really one of our goals is to continue to create awareness through our trainings, our national and international conference presentations, and also through our resources of really the unique gifts of human interpreters and translators. We really want educators to understand the connections that human interpreters and translators can make that go beyond words, right? The family engagement that interpreters can achieve using their tone of voice, their demeanor, their choice of words, their cultural awareness, that's not something that can be replicated by AI. And so we are pleased that so many of our partner organizations really understand that AI is not a new tool, and that it's just that, another tool that can be used to support practice. And we will continue as an organization to help our community of interpreters and translators to really adapt through information, through education, in collaboration with key organizations that really share that vision. Really, the main risk that I see for interpreters and translators in education and really in any other field is ignoring technology as a tool. As experts in language and communication, it's important that we use our voice to educate others on the responsible use of those tools and the effects of that human connection that we want to create when communication takes place, which leads to collaboration, which is really something that we want in any of our fields.
I think it's really, really interesting that you kind of mentioned the other side of the coin, so to speak, which is the perspective of the stakeholders or the those who are receiving the services. And in terms of it's so important. We often think that language services are provided in a vacuum to people that are they're just receiving, but they're not active participants in terms. But we know that when people are given the tools to advocate for themselves, they will use them, and I think that's really quite interesting. That because of the nature of what you do in education, that is a factor that is highly considered. Thank you so much, Anna. Now, Natalia, talk to us a little bit about what's happening in your sector, in the medical sector.
Well, I see the main risk for all of our sectors and for healthcare interpreting too is that chilling effect that the executive order about the English as official language is creating among consumers of interpreting services. And that gives an opportunities to providers of interpreter services to use the moment to reduce the scope, to go to the lower rates of payments for interpreters, etc. Because of the sentiment that is very, palpable in the country, that is anti-immigrant, and as recent as Tuesday now is almost anti-cultural competence. We will see in healthcare interpreting lower volumes of interpreting needed, requested, because not because there will be fewer people who need the services, but because, as I already said earlier, there will be fewer people who would be not afraid to exercise their rights to free interpreter. And there will be fewer people who will be afraid to seek healthcare too. Because of the policies and procedures that allow to share information with the immigration enforcement agencies. So no patient wants to go deliver a baby and then be picked up by ICE, right? Let's name the way things the way they are. And as a result of this chilling effect and everything else that's brewing right now in our field, I'm just so afraid that we'll start losing talent. And by talent, I mean interpreters on the ground. I mean all of us here on the panel and those of you who are on this, podcast as listeners, because we will see more and more burnout. And we also may see people being targeted by these new procedures because they are supposedly participating in something that could be called as unlawful discrimination. I don't know if I'm preaching to the choir, but it is important that despite all this pressures, we still need to read every new piece of legislature, memorandum that comes out, and be prepared to share our comments when there is the opportunity to provide comments. CCHI as an organization has joined all of the organizations here in advocacy efforts, and we will communicate with our constituents, with individuals who are interested in certification when we need their help to provide these public comments on any executive orders, guidances, etc., including the most recent and the most anticipated one would be the Department of Justice guidance about designating English as the official language of the United States, following the memorandum that was published on July 14th by Attorney General Bondi, that directed the department to create that, guidance. And this Tuesday, on 29th of July, another memo from the same office is about unlawful discrimination among recipients who get federal funding. And if you haven't read that piece of document, please do so, because there's a very interesting example there that cultural competence requirements may be considered prohibited use of proxies for discrimination. So the same way like cultural competence is now, we got rid of DEI, of diversity, equity and inclusion. The next one is cultural competence. Oh, and there were other examples, cross-cultural skills. I mean, this is important that we react, and we react as from different sectors, not just within one sector. So it's important for maybe for many of you to hear what each sector has, but I think what you will hear all of us and my colleagues saying later is we all have the same risks, and we need to know that we're not alone, and we are going to continue to do what we think is right.
Thank you so much, Natalia. I'm not ashamed to say that sometimes I think we're living in an upside down world. It's it's interesting times. Let's ask Christina Green to join us now from the ATA and share her thoughts. Would you unmute, please, Christina? I won't count the time against you either. You're still muted. There
Sorry.
you go.
Thank you so much. So, yes, the rescinding that executive order 13166 has had a negative impact for sure. Let's not forget, however, I don't see it as all doom and gloom for a couple of reasons. Let's just start by saying that before this, 30 states had already codified English as their official language, and that didn't change absolutely anything. This was before this executive order was rescinded. I am going to say, and some people will think that I am overly optimistic, that the situation as it is untenable. This is not a monolingual country. It is not, and it will never be. Are there risks to rescinding that executive order and declaring English as the official language and everything in the two memos that Pam Bondi wrote? Absolutely, yes. Now, I'm not saying the memo isn't bad. It poses risks to language access, for sure. However, we still have Title VI of Civil Rights Act of 1964, which still requires having meaningful access for LEPP individuals. And however, this, by rescinding 13166, there is a lot of confusion, and it can roll back access policies, language access policies. So there's going to be an erosion of standards, reduced funding and resources, decreased access to essential services, but there are also going to be economic consequences. And I believe that when we talk to the people who are claiming that English has to be the first language, we cannot come to them, and get a kumbaya moment about, equality for everyone. We're talking to people who did everything in their power to eliminate DEI because they think that DEI provides an unfair advantage to people who are actually socially disadvantaged. So if we want to reach out to these people, what we have to show them is how this is going to affect them financially, the financial impact that this is going to cause to their pocket, how our taxpayers' money is not invested correctly by using all this. Are they still going to try to replace us completely? Yes, especially those of us who speak Spanish, because, and and people who speak Russian and people who speak French, among other languages, right? However, I'm going to say, and I'm going fast because I know I don't have much time, but ATA, what is ATA doing? Well, I just said it before, and several people have repeated it. Advocacy and coalition building. We are not alone in this. Please, let's not be the 10% rule. We're out of a group, 10% volunteer, and only 10% of the 10% actually do something. This affects us all. We need to work together. We need to have education and public outreach, and that's where I would put the financial education with policymakers and the public in general, right? We need to adapt to technology. I understand that many people hate AI, but you know what? It is coming and it is here to stay. So we need to understand this. Professional development, we are promoting professional development right and left. ATA is. We want our members who are credentialed to be part of it, or their certification to be considered credentialed within ATA. We want people to get certified as translators. So even as the political and technological landscape shifts, the members of the association should remain the most qualified, most highly qualified and capable to meet the diverse needs of the clients and communities. I don't think it's going to change. I have seen clients asking agencies to sign an agreement in which they promise not to use AI in their translation or in their interpretation, also for privacy reasons. So it is a very uncertain time, but I don't believe it's all doom and gloom.
Thank you. I'm certainly hopeful as well. And I like to hear it also from those who are out in the trenches advocating for our profession. So thank you very much for those thoughts, Christina. And I'm going to ask Angie Birchfield to join us now and to talk to us about this subject and how her association is reviewing it, or how you've evaluated it.
Well, our point of view is always the advocation part of it, and how we can make changes at the legislative level to give us some sort of protections. I agree with everything that my colleagues have said thus far, kind of leaving me with a little bit less to say that I had planned to say. But nonetheless, I feel that we can always look at this as the flip side of it all. There's an argument of, okay, we change the language to being English standard, but we also want to make sure that if we're going, if this is how they want to proceed, and when I say they, I'm talking about the government, they need to also kind of flip it and make sure that you dot the I's and cross the T's as far as with the deportations go, basically. Just different things that I think can be implemented to protect us in that sort of thing. So we are looking at how we can regulate in AI. AI is here to stay. It can be our friend or our foe. We want to, keep it so that it stays and is used as it can be used. We as interpreters can have regulations that we only use. We use AI as a tool to assist us with the work that we do on a daily basis. I mean, everybody looks at their electronic dictionaries and for interpretation assistance and so forth. But what we don't want to see happen is that we just sit here and not do anything and not be proactive, like I said before, about being proactive versus reactive, and really implementing the implementation that will protect us. So, one of the things that was very worrisome was when the DOJ thing was, I'm sorry, the Doge issue came up, was I heard one of the players that were part of that group say, we're going to replace the 911 system with AI. Well, I can tell you firsthand, I've had that experience as a transcriber of an AI being used in 911, and it did not work, and it actually put the police officers in danger of the event that they were responding to. So one of the, let's see, one of the, I think that what we're going to have to do is keep the exam competitive enough so that we can keep up with AI, compete with AI, because a lot of folks, talk about the percentages of how much better one is than the other, and it's apparently very close. We want to make sure that, let's see, what else? I think everybody covered everything. There's really not much left to say, really. We do have the Court Interpreters Act of 1975. We have the right to language access through that law. We've got Title VI of the Civil Rights Act that was already mentioned. And one case that you might want to look up if you have the time is U.S. versus Bailón Santa Ana, which is a case where um, the person gave up certain rights that not knowing that they did, and it really affected how the outcome of their case. But again, we need to continue advocating and pursuing pathways to codify the laws that govern our profession. And more importantly, as I said before, complacency, there's no room for it right now. We need to be proactive. And I think I can speak for everyone here this evening that we all feel the same passion, and we need to bring it together and be able to make it better for our future interpreters. I'm on my way out of the profession soon, even though I don't look like I'm old enough, but I am. And I want to leave a legacy. I don't want to leave our profession in shambles. So I'm all for whatever ideas everyone has so that we can bring this together and we can all be proud of what we did.
Thank you.
Thank you.
Thank you so much. Thanks, Angie. And we've got one more panelist for this question, Joanna Carriero from AAITE. Take it away.
So I'm going to try not to repeat a few things, but I do have a few comments. So first of all, I would like to make sure that we all agree on the fact and we all understand that we're not using this platform for political ideas or statements. I think that what brings us together here is really a huge passion for giving people equal rights. And I think that without sugarcoating anything, we really need to understand that there is nobody that is less vulnerable. The same people that we have been engaging so far are the same people that are under attack. So families are under attack. Bilingual staff is under attack. DI is under attack. Patients that don't speak English are under attack. Students are not going to school because families are afraid. We still don't see the numbers going back to where they were before. And so if I go back to your initial question, Maria, because I think that in the flow of responses that has been a little bit digressed, if I remember correctly, please correct me if I'm wrong, but you asked about, due to all the federal changes, right? What are the specific risks that we see happening in language access? And so I will start with really having very clear what are the big hints in this framework. Executive Order 14224 proclaimed English as the official language. Well, thank you so very much. It was already de facto in many places. So the memo came out regarding the implementation of Executive Order number 14224, and it's not as bad, but it's still somewhat concerning. If someone on this chat, on this platform has not read either the executive orders or the memo, I think it's time for us to talk by knowledge, not just by hearsay, because there are a few things in the guidance that affect anybody and everybody. And so the removal of the Executive Order 13166 has wiped off 25 years of ways where we were trying to implement the direct and support language access. And now we have to find new ways to adopt and adapt. But we can do that only if we do it competently, because each one of us has a bigger responsibility than what we had 10 months ago. And so what do I foresee as risks and how we can beat this? Well, first of all, understanding exactly what these changes really mean and what is the impact on the job that each one of us does. Up until a few days ago, the Title III funding were gone. And AAIT has worked through our awesome Dr. Bill Rivers chairing the National English Learner Roundtable to reset these funds, and they were released. So we are working on actual moves to get things moving. And this does not happen just because people hear something. And to go back to the doom and gloom vision, I agree that it will never be as gloom and doom as long as there are passionate experts that really do this competently and strategically. Insufficient professional competence is something that is going to backfire. Again, I cannot stress enough the fact that we have that responsibility. Now, what is AAIT doing about this? Well, we have done advocacy. We have done advocacy behind the scenes, in the forefront, on the hill, in the schools, at the conferences, supporting other conferences. Beautiful, beautiful partnership with the Nagget conference at their last conference. We have supported in creating education and awareness. But again, it doesn't matter how many of us talk about things, it's what each one of us does and what is the ripple effect that each one of us creates. And then leveling up our education on every single term. Two takeaways: the law is still the law. And we may go back in time. These 3 next years are going to be tough. How do we build resilience to move on?
That's a good question. That's a very, very good question. I think that a couple of good comments have, many, many good responses have been presented here. And I definitely want to just piggyback on one of them, which is do read up on the legislation, do keep up with the news, and do keep up with the progress of the different changes that are happening, because a lot of it is happening very, very quickly. And just by listening to the headlines, you may not necessarily get all of the information and what it really, really means for our industry. So I commend all of the leaders who are trying to make heads and tails of it, and taking the information that is important and presenting it to us in all of these public statements that are multi-association. So we are we've finished our first part of our webinar, and now we're going to go into what I like to affectionately like to call the lightning round. This is going to be more of a thematic section where each of the panelists is going to have an opportunity to participate with a few others in answering 2 out of the next 3 questions. And they will have 1.5 minutes to respond, and to give us their view on these questions that we are going to cover. Now, our written survey, our comments echoed the chart data from the pre-webinar survey, indicating that one comment, for example, was certification boosted my job request tenfold. That was one experience. Yet some respondents still face cost barriers for training and for licensing. Not everyone can afford the training that is required, and not everyone can afford to, take and retake the examinations. Also, several noted the absence of certification exams in certain languages or in the education sector, even leaving qualified colleagues without a credentialing path. I know that among all of the organizations here, there have been different approaches to this. So I would like to ask my colleagues which competencies, whether these be certifications or training, will become increasingly important for interpreters who want to stay competitive and relevant. And I'd like to start by asking Natalia Martinez to talk to us, because I think that CCHI has an interesting take on how to address this.
Thank you, Maria. Yes. Working with the certification commission, kind of like I almost feel like it's the question for me personally. But anyway, I do believe, despite the fact that I'm kind of, again, tooting the horn of CCHI, that any person who is currently being paid to interpret in healthcare should be certified. That's what my whole life is about, and that's why I cannot, get myself free from that belief. And at CCHI, we have created and already we implemented for 2 years a new credential that is called Core CHI Performance that is available for interpreters of any language, and it has a practical exam where it tests cognitive interpreting skills in English that has been validated to correlate as if we tested you in 2 languages. And with that, there is absolutely no excuse not to get certified. And so certification has real advantages. This year, we've conducted the Global Workforce Survey of healthcare interpreters, and it received over 1,400 responses. And in the responses, we have, demonstrated facts that certified interpreters have higher salaries. They more often have full-time positions. They more often derive 100% of their income as healthcare interpreters, and they have higher paid, hourly rates and per minute rates. So certification means that economically you will be in a better position than if you're not certified, on top of the fact that you will have more chances to survive these turbulent times, including AI disruption here. Because certified interpreters, according to our survey, are more frequently assigned additional tasks or take upon themselves additional tasks that are vital for the organization. They are not just interpreters. I hate that just interpreters because it's such a complex word that is comparable to neurosurgery, but still they're not just interpreters in an organization or in a hospital. They do many other things that AI cannot do, and they'll still have to hire some human to do those things if they chose to replace interpreting part of it. As for competencies and training, I believe the focus should be on 3 things, and I'm going to be very narrow, very specific, because this is something that you can start tomorrow, not 3 years from now. First is interpreting skill training that is language specific and includes instructive feedback. I know it's nice to attend conferences where you just sit back and just listen to it, but you need to seek training that you get the instructor tell you what you're doing wrong and what you're doing right. Secondly, training in simultaneous interpreting and sight translation, because our exams say that people who pass and have higher scores on sight translation section will have higher scores on simultaneous and on consecutive. Very interesting, but that's, one of the interesting findings. And then training in integrating AI tools into our interpreting workflow. And that includes self-directive, of course, because you need to be working with AI like with any skill. You need to do it daily, and you need not to with the preconceived notions, like, for example, oh, AI is bad at interpreting idioms like break a leg. Guess what? That was true 8 months ago. Now, any AI tool will interpret break a leg, translate, speech translate, whatever way you want to call it, correctly, and will offer you better versions and will give you the rationale of why this version would work in this context and that in that context. If you have not worked on a weekly basis with at least 2 AI engines today, you're behind. You need to catch up.
Thank you. Thank you so much for that, Natalia. Ana Soler, join us now. And you have a minute and a half. Sometimes time stretches a little bit, but there you go.
I'm glad it stretches a little bit, but we are proud to say that we have completed a pilot process to establish a national certification test for spoken language interpreters and interpreters in education. And this process has really taught us so much about our profession, about the unique skills and abilities and knowledge that certified interpreters should have, and also the training that is required to obtain a national certification. So really to stay competitive, to stay relevant, interpreters need to distinguish their skills, exactly what Natalia was saying, and their competencies from everybody else. And so they must really demonstrate flexibility and awareness of their ethical principles as well. They also need to be aware that we work with people and for people, right? And ensure that that humanity that distinguishes our job really remains relevant. So interpreters and translators, for that matter, who want to remain competitive should learn about the responsible use of AI in their practice, and should become experts at communicating with clients about the limitations of that technology, and also the impact that the technology can have on that effective and equitable communication that we need to have. But really, to stay competitive, interpreters need to take time for self-care. We haven't really talked about that. Really during the difficult times and these uncertain times, language professionals really need to hang on to each other and really must keep each other informed and understand that storms come and go, and that through each storm we need to refill our own cups so that we can share that professionalism with our clients. And so that applies whether you're an educator, whether you're a patient, whether you work with lawyers, etc. It's the same concept, because honestly, no certification, no training will matter if you as an interpreter, you're too mentally or too physically exhausted to do your job. And so, if you have interpreted simultaneously or consecutively for 30 minutes, you know exactly what I'm talking about. So being competitive means really starting by taking care of yourself, taking care of your voice, your skills, and, being there for you first. So hope that helps somebody out there.
Absolutely. Those are some really, really good nuggets of wisdom that I think a lot of interpreters have also probably learned the hard way. What happens when you don't practice self-care and you treat your instruments, your voice, your hearing, as actual work tools. I'd like to have Lily join us from Nagget and talk to us about this topic.
I have to agree wholeheartedly with everybody who's talking about keeping up with legislative changes, with AI, advances in AI, learning how to educate our clients, learning how, also, I would add, learning how to market in the evolving social media landscape. Many of us old timers may be used to, we love books, we love the feel of paper. We may have resisted getting familiar with social media, and we have to take the plunge. We have to learn to be relevant, learn how to show our clients that we are relevant. We need to also, many of us who come from, say, a literary background or an academic background, and thus are extremely well suited to being interpreters and translators, may also need to just learn to be more business savvy financially, and therefore to get out there past our comfort zones and learn to find new opportunities to diversify our revenue streams. As I mentioned earlier, there's not enough work in Japanese, so I do a lot of academic editing. I do a lot of teaching. People may have to find new sources, new sectors in which they can provide their interpreting services or language-related services, or maybe if you have graphic design skills or some other skill, to find a way to complement your daily interpreting assignments with some other talent or skill that you have. And definitely, as Joanna has mentioned, work with others, take on individual responsibility to help educate colleagues, to network with colleagues, to volunteer your time to help the people on advocacy committees, and to keep up with all of the information about the ongoing efforts to combat the attacks on the sectors that we serve. Thank you.
Thank you so much. Thank you, Lily. We are going to have Angie Birfield join us now to talk a little bit about this subject. What is APTI doing to help your interpreters who are members of your organization stay competitive and relevant?
Well, a lot of the things that were already mentioned were part of what we were going to also suggest, but we think, certification is very important in all of the sectors, and we're super excited about seeing that certification will become available soon for educational interpreters. I'm a firm believer that by being able to have the certification, we're able to raise the bar in our profession, showing that we have taken the time and made the effort to raise our level to the standards that of the exams that we take. With that said, however, we also need to make sure that we advocate to keep the exam competitive, because in my personal sector, which is with the court interpreting, it's very challenging because I am a member of the court interpreter advisory panel for our judicial council in California, and I'm constantly challenged by some of the administrative members as to, well, why is it important to have a written exam, or why is it so important, for this and that and the other? It's because our job, in our jobs, in our daily jobs, we are on a constant learning curve. Every single day we get things thrown at us, and we need to pop out with that interpretation in another language, and it's challenging. So with that said, we should also, our goal is to also empower the candidates that want to become and aspire to become certified in the sectors that they would like to work in. And I think it's very important for us to take that role as certified interpreters and to help out those that want to come into our profession. And what else? That I think pretty much covers everything that I wanted to cover. Again, I thank my colleagues for doing a lot of this talking for me tonight. And I completely support all of you. And I hope that we can keep the interpreting it where it needs to be without diluting any part of the exam, and making sure that we keep that level up so that we're there when we do our work.
Thank you so much. Thank you so much, Angie. In the interest of time, I would like to merge the next two thematic conversations that we were going to have, because we're really going to talk a little bit more in depth about advocacy for a profession, which has been brought up during this webinar in many ways. Without it, we can't grow and be seen as the professionals that we are. And that advocacy can take many forms, including compensation, public recognition, having an understanding of the needs of the interpreters, and also advocating for higher for more certified interpreters, and for different types of governances in terms of how interpreters govern themselves. So I'd like to have both questions joined in terms of the role that your organization will play in policy making, advocating for interpreting rights and working conditions, and how, and also talk about the associations that the inter-association collaborations that you do, because we have talked about this a little bit, and there has been a lot of there has been a lot of mention of already collaboration. So why don't we go ahead and mix those two so we can have more time for our Q&A. If I could have Christina Green take the mantle on this one.
Absolutely. Thank you very much. It's a great question. So in terms of what the ATA is doing to foster policy making and advocacy, I will say that we have a very strong role. We play a very strong role in protecting working conditions and rights, particularly regarding the classification of translators and interpreters as independent contractors. We have taken a very strong stance against legislation that could misclassify our professionals as employees. We have promoted professional standards. The most important thing, because now everything is quick, everything is done by a machine, is maintain high standards of competence. And of course, ethics within the interpreting profession. We have 29, we offer a certification for translators in 29 languages. So that's from English into other languages and also backwards, those languages into English. So that amounts to 29. And we are fighting through the Interpreters Division to proposals that seek to lower the professional standards. And that we think it's important to ensuring the integrity of the services. We advocate constantly for language access. So we are a strong voice. We know we are a strong voice. And we collaborate with other associations, with our sister associations that are present here. So we seek to influence legislation and policy because we talk directly with lawmakers and government officials. We have amazing members. We have, Dr. Bill Rivers has been a pivotal member of or person, to help us move forward and implement certain help implement certain rules. So we have provided, for example, feedback on bills, how things in courts or in medical fields or whatever have tried to derail what we actually are and lower our standards. So let's talk about fostering collaboration. So how are we fostering the collaboration? Well, certainly we are in a very unique position to foster this unity between different interpreting and translating fields, like court and medical sectors. What we need to do is elevate the profession as a whole. We need to facilitate communication and networking. It's very important that we join, we work hand in hand to create conferences and workshops together, such as this one. So this is very valuable. To have committees that are cross-disciplinary, so representative from various specializations and various associations, and to have online forums and resource libraries that everybody can have access to. We need to develop unified standards, unified code of ethics. We have worked, Nagget, AAITE, CCHI, and ATA have worked together to present regarding a code of ethics in the different areas. And if we are able to establish consistent training and education requirements, then that is going to create a very solid basis for us to continue promoting the best practices across the board. And creating a generalist certification would be a great thing. Creating a certification is something that is very costly and it takes a lot of time. And that's why it's not as easy as many would like. Okay. And last but not least, we need to elevate our profession through advocacy, public outreach, highlighting interpreters' role as a cultural and linguistic expert, and showcasing research and innovation in our field. How can we use things? How can we use innovation to get to show the benefits of using professional interpreters? So I think that by using those collaborative strategies, we can improve the quality of interpreting and translating services, and also create a more unified and respected professional field.
Thank you. Thank you so much for that, Christina. I believe that some of your other colleagues want to jump in on that. Let's have Joanna jump in now with her 90 seconds.
90 seconds? Oh, I would not like the interpreter interpret for me then. Identify, educate, mobilize. This should be the mantra that every single of us should follow in order to advocate for us as professional, for each one of us as a professional, but also contribute to association. I cannot stress enough what Lily said about the work is, how do you say, the workload is heavy and there are very few hands on. So please contribute. 2, AIT has had town halls, written cards to our representatives on the Hill. We must have our voice heard, and this is the time to do it. Because we can work as much as you want about working conditions. If there is no work, there are no conditions to be talked about.
Thank you. Thank you.
And so, standards are another beautiful topics that we have not talked about yet, but ISO ASTM standards are there to also protect and provide guidance on working conditions. How many of us have bought the standards, for example? There are no words with no actions, or there are many words with no actions, and these lead us nowhere. Lastly, interpreting should be one voice, one message, one profession. Translation should be one voice, one message, one profession. And so the coordination of efforts that some of our organizations have put together has never been done before. Some of the organizations on these platforms have worked together to support each other, to share, to co-sponsor, to make their voice bigger. Because sometimes it's about education, sometimes it's about healthcare, sometimes it's about translators, sometimes it's about interpreter. But if we put all of us together, it's exactly what we want. We need to yell, we need to scream. And we can now talk about compensation. We know that, but the public recognition does come with the competence, the way we talk about ourselves and the way we uphold standards and promote our services. I know 90 minutes pass very fast.
Thank you. Natalia is up next.
All right, thank you very much. CCHI is slightly different in a slightly different position than the rest of organizations on the panel today, because we're not a membership organization. We are a standard setting authority. And for that reason, we see our role in policy making and advocacy threefold. First, to be a clearinghouse for collecting information about interpreting profession, specifically those who serve the U.S. health systems. And this year, we've conducted the Global Workforce Survey that we are going to publish the report of in August. So please be on the lookout. It's an amazing set of data that has never been available before. Second role is to disseminate best practices as wide as possible through our 17,000 subscribers list, social media channels, and website. And from our homepage, you can access a specific page we just launched in May that is called Interpreter Advocacy and Resources for Changing Times, that has sections such as language access, coping with anxiety and stress, immigration, how to identify misinformation. And some of the legal documents we mentioned today, they are on that web page, so you can quickly access those. And the second role, which is very important to us, is participate in cross-cultural, cross-sector advocacy efforts that go beyond our T&I professions and engage with anybody and everybody. And that I'm kind of echoing Joanna, and I think I'm going to say the phrase that I heard from her first: if we're not at the table, we're on the menu, and we do not want to be on the menu. And for that reason, we need to involve in different advocacy groups. We have a special position, paid staff position at CCHI called Language Access Advocate, and many of you know that person, Jorge Ungo. He represents us at the National Language Access Coalition that is spearheaded and coordinated by Dr. Bill Rivers, who already was mentioned today, who meet. At first they met weekly. Now I think they meet bi-weekly, but then again, I see them meeting weekly. So there are people in the field that are working daily on these issues. We're also part of the Association Advocacy Work Group, along with AITE, Nagget, ATA, NCIHC, that is organized by the Association of Language Companies. And we also, through our commissioners, work at the Safe AI task force that was mentioned before. So we sign on to various letters, including letters that Nagget recently signed about what was happening in Ohio, California Supreme Court, but also RID about the potential threat on sign language interpretation in this country. So, and we are going to obviously submit comments to any guidance that the government will publish and will open for public comments. So we encourage everyone to do so because, again, we do not want to be on the menu.
Thank you. Thank you, Natalia. Angie, you had a closing comment before we want to go to our main Q&A?
Basically, just wanted to reiterate based what everyone else had mentioned. APTI was created out of necessity, and it was because of the challenges that we had in California through the AB5 debacle and other issues that were taking place in the state. So we have a lot of experience. I personally have co-authored many bills that have passed through the legislature that have to do with interpreting. We are here as advocates for all of the organizations that are here today. We want to work together so that we can do exactly what Giovanna said, scream and shout and get our voices heard, which we absolutely need to do. We need to, again, like I said before, we need to be proactive versus reactive, and we need to not be complacent. So I encourage you to come to our we're going to be having a conference in California coming soon, and I hope that you guys will come and visit with us and spend some time with us so that we can show unity and how we can all work together. Thank you.
Thank you, Angie. And never fear, we'll have all of the information on how you can find more information on these organizations in the materials that will be available to you. And Lily wanted to also pitch in here. Go ahead.
Hello. Just to echo something, but with a slight twist. Nagget has been working, as I mentioned earlier, with our partner organizations so that we endorse each other's letters or co-author each other's letters, try to share the burden of the research that goes into these letters. And so that's one streamlining process. We have also been going through all of our past position papers and deciding which ones may need some updating. Some of the data is old and may need some refurbishment, maybe new mentions of AI and other technological advances. So the Positions Papers Committee is working on coming up with new research that will be the basis for when we can quote our own position papers. We earn respect in different ways than if we're citing other academic papers and so on and so forth. And I'll stop there because everybody else has spoken so powerfully. Thank you.
Thank you. Thank you so much. Let's open the floor up to, I know we have a lot of questions, but we also had a lot of really good information that we needed to share with you. Let me look through here. This is a really good question, and I don't know if there's anybody present here who might be able to at least shed a little light on the on how, from Cristal Rojas, who's asking, I know this is more general towards spoken language interpreting, but does anyone have any idea of how this might affect the ASL interpreting field, which is also, a partner field, and we do collaborate with them very much. Any of our participants, I see that Christina Green has her finger up. Go ahead, Christina, please contribute to this.
Thank you. I will speak as a member of Safe AI Task Force. And I will say that American Sign Language is different insofar they are more protected by the American with Disabilities Act. So much more than what we are by Title VI of the Civil Rights Act. So, for example, I'm giving you a very small example of this, and it's the legislation in Wisconsin seeking to replace us with AI. Originally, it was written with ASL and spoken languages in mind, and right after it was written and presented, it was taken back and ASL was taken off altogether. So is it affecting languages in general? Absolutely. Is ASL affected? Yes, but not as much as spoken languages. The focus here is, I know we talked about not being political, but this is very targeted to a very specific group of people who speak a few languages, and it's not ASL.
Thank you. Do any of our other participants have anything that they wanted to share? I think it's also, go ahead, Giovanna, sorry.
Just to complete and complement what Christina said, just to be clear, it's not that there are no threats for ASL colleagues. There are, but they're different. And there is a lot of information that the Safe AI has put out there regarding the technology, but there is also a number of other conversations that have gone on the RID side, for example, and they have put resources out. So I don't think none of us is really fit to answer the question specifically, but at least we can send people to the right resources.
Thank you for that. I'm going to get through some of the quicker questions. We've had a number of questions asking whether or not interpreters who are living overseas can get certified, and specifically asking about CCHI from outside the US, and in general about all types of certifications. So let's start with Natalia, and then maybe we could have some additional comments.
Yeah, I mean, CCHI exams are available to anyone who qualifies to take them and can follow the procedures for the exams. Our all credentials have to take two exams. One is knowledge exam that's available online, and that one is easier to be accessed from anywhere in the world. However, the second tier of certification is a practical exam, interpreting exam, or cognitive interpreting skills exams. Those exams are available in the United States and in Canada. So for that, we're very happy that we had the foresight to have Canada available, because currently some countries are not allowed to enter US. So if you wish to go to Canada, you could do so. However, we do strongly support the interpreters who know US health systems. Our exams are very specific to US health systems. So if you're not working for US health system, there is no reason for an individual to take our certification.
Thank you. Thank you. Any of our other panelists would like to respond to that in particular?
Yeah, I just wanted to add and thank you, Natalia, because you have been a role model as we create this pilot certification test for spoken language interpreters. We did want to make the test as available to any languages as we could possibly have them. And I saw in the chat a few people asking if their particular language was welcomed. And one of the things that we wanted to do from the very beginning was to make sure that it was as accessible as possible. So for our setting, we have found that a lot of interpreters who work overseas do have the opportunity to interpret for school districts here in the United States, and they do get to know the school system quite a bit. Sometimes, they tell us a little bit of the terminology that sometimes we are not aware of. So we do want to keep that in mind as we continue developing the test. So to answer your question in terms of educational interpreters, that is something that we do want to do. We want to make sure that it is as inclusive of all languages and as many interpreters as we can certify.
Thank you. And just out of curiosity, does the ATA provide testing online for people outside of the US, Christina?
Yes, they do. Being certified translator, which again, we're talking
Yeah.
about translation, not interpreting. But
Correct.
to be a certified translator, you do not need to be a US resident or a US national. You can take that test virtually. Right now, on the computer, you can take it from anywhere in the world, provided that your language combination actually does have a certification.
Thank you. Thank you very much for that answer. I hope that's useful for those who are watching us. There's a couple of comments about advocacy. One question is as to, for a busy professional, busy life, what can a person do if there's so much work to do? What can a person do if they're limited in time? And then I'm going to piggyback that one with another one from an anonymous attendee who is saying, even if we succeed in all this advocacy work in the US, how can we compete with overseas providers who will provide services at lower costs and same quality? Is the advocacy work for US-based translators for US and interpreters? Who'd like to jump on that?
That's a tough
Thank
question.
you, Giovanna.
Yeah, that's a tough
It
question.
is a difficult question, and it is a multifaceted question that can't be answered in a few minutes, but it is important.
It is important, but and maybe I'm going to be very unpopular for this, but my point is that when you are prepared, you still have work. So I understand that we run against this rate thing all the time, and we are not talking about compensation. We're just talking about fair wages, right? But nothing can be looked at from an isolated standpoint. In other words, doing the advocacy, talking about working conditions, talking about the impact is also part of the work that we do to advocate for jobs here in the States. And so I often worry about that the question about the compensation is the only one at the forefront, when that is actually part of a bigger picture. And I'm sure that Natalia and Angie have more to complement what I'm saying.
Go ahead, Natalia.
Well, I want to say that it's important to think that I want to answer the first part of the question about how, when we're so busy, can we advocate? What can we do? You have today here on this panel people who are maybe triple busy than, many others, and you, the ones who are in the audience, are also very busy, and yet you are on this panel, right? So you need to find the passion, you need to find the understanding that you need to, keep remembering that now is the time when we are all under attack. And some of us who come from countries like me, born in the Soviet Union, who know what the result will be if we do not stand up. And so finding time for advocacy to me is the wrong question. The question should be how much time, and you can start with 10 minutes a day. I will do advocacy. First, I'll go to Gemini in my Google account and I will ask what advocacy group exists in the US or in whatever country you are about language access. And then I'll follow those links and then I'll join them and then I'll join their calls and then I offer some help, like I will take notes for you or I will edit the Zoom AI notes for you. So it doesn't have to be big. It has to just start, and it has to be consistent and daily. And 10 minutes a day, each one of us can dedicate to our profession out of everything else we do.
Thank you very much. Anyone else want to jump in on that one? I would just like to say that it's, one of those things that you can do with those 10 minutes a day is if you aren't able to donate those 10 minutes, then become informed, become a member of an organization and support their efforts, because by being informed, you are going to be able to share that information and that knowledge that you have with other people when the situation arises and when you have a situation that merits sharing that knowledge. Checking here. Wonderful panel presentation from Flavia Brown. Thank you very much. Do you think interpreter training programs are adapting fast enough to meet future demand? It feels like a competition of who improves their skills faster, humans or AI. And I know that Anna's typing an answer as well.
I was just smiling
you
because
are
I'm
typing and
but
speaking at the same time. You're multifaceted. Go ahead,
I
share with
am.
us.
So, Flavia, thank you so much for that question. And I think we as interpreter trainers, we need to adapt as well. We need to be learning. We are all becoming very educated. And it seems that every single day there's something new to learn, and there's a new piece of technology that we need to look into. So I think it is important that we as trainers also adapt, also remain flexible. But that we also find other trainers to work with who know more than we do, so that we can collaborate and create trainings that are relevant. We don't want to just, check the box and offer an AI training in general. We want to make sure that it is very specific to the needs of the people that we serve. So I think it is about educating ourselves as trainers, finding out what you need as a participant, as a student, so that we can create those tools and create those resources for you. That's really what we want to do first. Thank you for that question.
Thank you, Anna. Joanna?
I don't see it as much as a competition. If there was a competition, we would have a better workforce and a better questions. I think it relies a lot of not getting stuck in what we need to do rather than focusing on the doing. I personally see that there is a lot of new trainings, new webinars, new people that can teach others that more than ever before. I think that we all as individual professionals need to start learning about what the profession is about. The results from the survey, they clearly shows that most of the respondents did not even understand that the question about being certified is very concerning. And so if we're talking about leveling up, upskilling, and we're still dealing with people that do not know what being certified means, we have a problem internally. And I say that with a lot of love. I do, because I spend my life advocating for interpreters. So I want every interpreter and translator to uphold the responsibility of their own public recognition, because each one of us is a legacy for the other. And we have an ethical responsibility to uplift each other, but also to do our own job.
Thank you. Thank you for that. And go ahead, Christina.
I just want to, my husband used to say something that I always found very useful. When he would talk to our clients, he would say, you can have it fast, you can have it good, or you can have it cheap. Now pick two. So the fact that it's cheaper in another country, let me just say this. I'm not saying it's less of a quality, but many of our customers in the United States, if you have a federal contract or a state contract, demand that every provider is based in the United States. So when you offer a service that is below what is considered the median, and again, we don't talk about prices because of price fixing, but if the median, whatever that price is, then they understand this is something that is outsourced outside of the United States. So I don't see it as a competition either, like Joanna. I just think, if you're good, people are going to continue calling you. And that's about it.
Thank you, Christina. I have an interesting question because it has already been raised, and these are resources that are readily available in the websites of many of your organizations. What are some tips on the verbiage or language to use when advocating for the profession or to work with hiring humans in the space of language access? It says also at the bipartisan level. I know that CCHI, Nagget, ATA, the TISL, AITE, I may have missed AAPT. I believe all of you have resources on your websites from your different campaigns, and you have trainings, and you have, I see Natalia ready to speak on this.
Yeah, I want to, say that it's interesting to ask this question to AI, right? And see what AI will tell you. But the things that come to my human mind are, first of all, if you're talking about bipartisan terms, you need to make sure that you're talking about efficiency and fiscal responsibility. So frame it like that. And it is more efficient to do things right the first time around than have patients to be readmitted to the hospitals because they've had misinterpretations happen. Same thing with mistrials, etc. You name it, right? And the fiscal responsibility is AI may seem to be cheaper on the surface, but again, do you have the money right now to pay the amount they're charging you? Do you have the infrastructure right now that they're charging you? Do you have the tools available in every patient's bed, by every patient's bed to do that? So that's kind of things that they may understand. I also would talk about from the point of view of public safety and national security, right? If you have individuals interpreting sensitive situations, let's take it outside of healthcare for a second, who are, who are not US-based interpreters, who or use AI models that are cloud storage, who knows where, you run a lot of risk. And then the other things for the rest of us, not just the bipartisan aspect of it, but we need to stop talking, to stop using our jargons, right? LEP patient sounds great. Who the heck is that, right? And it is a person who doesn't speak English. It is a grandma who's lived here for 50 years and she's too old to learn. And she became a citizen because she didn't have to. She had a waiver to the citizenship test. So things like that, we need to speak at the level of the audience in the terms that they need to understand. We're linguists. We should be able to do it. The verbiage is our expertise. And if we don't have it, go to AI. It'll give you suggestions and you'll pick the best one.
Thank you. Thank you. Joanna, did you have a response as well to add to that?
Yes, and I would like to add to what Natalia said about fiscal responsibility. Every time we have conversations regarding language access, inevitably we talk about we don't have the money. And therefore, we as linguists need to do the right research and use the terms of the research in order to present, not to fight back, but to present, because we cannot always go with negatives. We cannot do this because, right? People that hear us want solutions as well. So how do we address this, the question of the budget? And I'm going to tell you that it's very interesting to note that nobody has ever done a true study on the cost of bad quality interpreting and bad quality translation. Because that would be a really good way for us as an industry to come together and justify why trained, qualified, credentialed, and ethical interpreters can deliver a much more, a much better work, much better rendition than anyone else. Another thing to talk about is verbiage. I want to add to what Natalia said about verbiage. When I ask my colleagues about language access, how they talk about it, and we cannot put a defense together. Think of being in a debate, because that's the way we develop our language, jargon expertise to discuss with people at the table. Because at that table where we don't want to be on the menu, there are people that know very well what is the goal of their conversations. And we sometimes need to start backwards. What's the goal? And start unraveling from the end. They use our critical thinking and our ability to read and learn in order to have our bullet points and debate every single point, providing solutions, because nobody likes to hear complaints.
Thank you so much for that response. It is time for us to go. I want to thank the panelists and the audience alike for your engagement tonight, your participation. We have had participants from the United States as well as many countries. In fact, we have a participant from Malaysia who wanted to know how it's from Gilbert too, who wanted to know how to make changes and contribute to the society in Malaysia. I don't know if there are any translation or interpreting associations in Malaysia. If there aren't, maybe you could be a founding member of said organization. I am sure that any of the organizations here would be happy to assist you with, information on how to do that. And so I thank you all for being here from near and far, and definitely from different time zones, which is also complicated for many of us. This discussion shows that while challenges remained, our collective strength is real. There is hope. Nearly 90% of the interpreters in our pre-event poll call professional associations essential. Tonight you met 6 of them, and 1 in 6 of you already serves on a border committee. So leadership starts here. But if you're not yet involved, pick at least one of these organizations or pick your local association. There are ATA chapters in most states, and there are local organizations that serve a myriad of different areas in each state or in each country, and become a member and volunteer for a working committee, because working committees is where policy, standards, and real world change begin, and your voice is needed. Our special thanks to Joanna Carriero Contras from AITE, Angie Birfield from APTI, Christina Green from ATA, Natalia Martinez from CCHI, Ana Soler from NATISL, and Lily Selden representing Nagget. And many thanks to all of the members of each organization, those who answered our survey, those who shared the posts, and also thank you to all of you who participated, and the De La Mora team who also worked on making this event possible. If you registered, you will receive the full survey report via email. And if you're watching on YouTube and didn't register but would like a copy, please email info@De La Mora Institute. That's info@DELAMORAINSTITUTE.com. So thank you all for joining us, and